Hi, this is Dr. Mark Poole, and I am going to chat about autoimmune hepatitis. This is really focused on going through some of the images that specifically cover the histopathological patterns of hepatocellular injury that are more typical of autoimmune hepatitis. So just as a review, hepatitis, again, is the term that describes histopathological patterns of hepatocellular injury due to and associated with inflammation. And as covered in the other talk on acute and chronic viral hepatitis, this is a nonspecific collection of patterns. It can be seen in a variety of different causes of hepatitis. So this is just focusing on those that are more typical or characteristic of autoimmune hepatitis. The three typical histopathological features of autoimmune hepatitis are extensive interface hepatitis, a plasma cell predominance in the inflammatory infiltrates, and hepatocyte rosettes. Now again, keep in mind that all of the other features of chronic hepatitis that were discussed in the other talk are also present in autoimmune hepatitis. These are just three features that are more typical for autoimmune. So the first is interface hepatitis, and I've outlined the area of the interface in red. This is the inflammation that's at the interface between the portal area, which is outlined in blue, and the rest of the lobule that's to the left. And it's this intense interface hepatitis that is one of the features that is more typical for autoimmune hepatitis. This is just a higher magnification view, again outlining the area of the interface in red and the portal area in blue. And here's a couple of bile ducts, or one bile duct that's just cut in two planes that is present in the portal area. Another feature of autoimmune hepatitis is a plasma cell predominance in the inflammatory infiltrate. Again, autoimmune hepatitis still has portal and interface inflammation, just like other forms of chronic hepatitis, but there seems to be a more plasma cell predominance in autoimmune hepatitis. And the blue circle highlights numerous plasma cells that are touching each other. This is the highest magnification that I can get, but you can appreciate that some of the cells anyway show the characteristic eccentric condensed nucleus and abundant amphiphilic or purplish cytoplasm. The final typical histopathological finding that's associated with autoimmune hepatitis is so-called hepatocyte rosettes. In areas of inflammation, these are collections of hepatocytes that seem to form glandular-like structures, and they group together forming what appears to be a small gland, and we call these rosettes. And these are what are encircled in this image. So to summarize, autoimmune hepatitis has the same features of acute and chronic hepatitis due to hepatotropic viruses, but there are some typical histopathological features that we find with autoimmune hepatitis. This is extensive interface hepatitis, plasma cell predominance in inflammatory infiltrates, and hepatocyte rosettes. Now, if you remember from the notes that autoimmune hepatitis is classified primarily serologically, and so what we're looking for in biopsies are features that are typical, features that are consistent, maybe there's one out of the three features, or features that are not typical for autoimmune hepatitis, in which there may be features of chronic hepatitis, but just not the features that I've outlined here that are, quote, typical. So that's it for autoimmune hepatitis. Not much to remember, just these three typical features and you have to interpret these in association with the serological findings of antibodies and so forth. Thanks.